Hi, my name is Kara Jacobs-Slifka. I'm a medical officer and part of the CDC COVID-19 response in long-term care facilities. Today we're going to talk about how to keep COVID-19 out and the importance of not working when you are sick. This is part of the key COVID-19 prevention messages for frontline long-term care staff. The number one thing that you can do to keep COVID-19 out of your building and keep your residents safe: do not work when you are sick. The virus causing COVID-19 spreads mainly from person to person when they cough, talk, or sneeze. But some people can spread the virus even without having symptoms. So you should wear a face mask while you are at work all of the time. This is called source control because the face mask prevents germs from your mouth and nose from spreading to other people when you talk, cough, or sneeze, which protects residents and staff. CDC recommends the use of cloth face coverings for everyone who goes to public places for source control. These may be able to be used by some nursing home staff who are not interacting with residents. However, cloth face coverings are not considered personal protective equipment and should not be worn instead of a respirator or face mask if more than source control is required, like when you're caring for a resident. What we have seen so far during the outbreak is that COVID-19 enters into long-term care facilities through the people who work there. You could spread germs to residents and patients without even knowing it. And the added benefit of face masks is that they also protect you from germs by keeping germs from touching your mouth and your nose. In order for your face mask to work, you have to wear your face mask the correct way. Do clean your hands before you put on and take off your face mask. Wear your face mask so that it completely covers your mouth and your nose. Remove the face mask, touching only the straps. And if reusing the face mask, fold it in half with the outer part of the mask folded in and store it in a paper bag or breathable container. Don't touch your face mask or your face, and make sure that you don't pull your mask down under your nose. Your nose must be covered by the face mask. Don't wear the mask on top of your head, around your neck, or hanging off of your ear. And don't store the mask on your arm or in your pocket. You will need to take your temperature and report any symptoms each day when you start your shift. If you have a new or different cough, sore throat, shortness of breath, muscle aches, or otherwise feel sick, you should not work. Some people have even reported symptoms such as a headache, losing their sense of smell or taste, or chills. These could also indicate that you may be sick. If you feel okay to start your shift, but develop a temperature of more than 100 degrees Fahrenheit or start to feel sick while you're at work, you should immediately notify your supervisor and go home. Many nursing home residents have become very sick, and some have died after staff in their building worked while they were sick. You play a very important role in keeping residents and staff healthy. Anyone who enters a long-term care facility must first check their temperature and report symptoms. They should also wear a mask the whole time that they're in the facility. This includes you and all healthcare personnel, support staff, housekeeping, dietary, maintenance, construction, administrators, consultants, vendors, visitors, everyone who enters the building. No one should enter a long-term care facility when they are sick. Many people work at more than one building or have more than one job. If you become sick, you should alert your supervisors at all of your work locations right away so that they can check for other sick staff or residents who may be sick. COVID-19 can spread very quickly in nursing homes and in other long-term care facilities. There is no time to waste. You can be a voice for your residents. Help make sure that no visitors are allowed on site unless they are visiting during end-of-life situations. It is more important than ever that you help your residents stay connected by finding ways for them to communicate with their loved ones, such as over the telephone or using a video call like FaceTime. Keep your residents safe by encouraging other staff and anyone else who comes into the building to stay home when they are sick, clean their hands frequently, and wear a face mask. Encourage residents not to give hugs or shake hands. They should practice social distancing by staying at least 6 feet apart. And social distancing is for you too. Anyone working or providing services in the building should try to stay 6 feet apart from one another, including in the break room and in any common areas. This is how you can keep COVID-19 out. Keep yourself healthy and keep your germs to yourself. Your residents' lives depend on it.